Welcome to the CNSA Global Health Committee podcast series. Throughout the series, we will be interviewing different nursing leaders to provide listeners with a glimpse into current, local, and international global health initiatives. We hope to provide students with a greater understanding of global health and to inspire students to pursue paths that will enable them to become future leaders in global health. We hope you enjoy.
Get started. Tell us a little bit about yourself.
Okay, now, so our focus is going to be on global health.
Yes.
And I didn't travel internationally for quite a while in my career. So, I kind of grew up, became a nurse, worked locally in mental health, then came back to school, then started to teach, and then I was at McMaster, then I left McMaster and went to another university, and then I was on sabbatical at my other university when I was approached by the University of Calgary. And the University of Calgary have a campus in Qatar, in Doha. So it's the University of Calgary, Qatar. So they were looking for a dean. And I don't know, it was just the right time in my life. And I thought, wow. So my husband and I went over, and I did my interviews, and we really liked it. And they eventually hired me. So we went back to live in Doha, and I ran the School of Nursing over there.
That's fantastic.
It was amazing. So one of my first experiences there is the students asked me, I think it was my first day, could I come and talk to them in their leadership class? Anyway, I go in and everyone is in black, right? So, and some have their face covered, not all I can see is their eyes. And I thought to myself, oh my goodness, how am I ever going to know these students? Because culturally here, you think you have to see the whole face, right? And I thought, oh my, how am I ever going to get to know them and their names? And you do. You recognize their eyes, or sometimes they take off their veil when they're in your office and there's no men around. And you get to know them. You get to know their walk. You get to know their talk. But that was one of my first impressions. How will I get to know these students? And there was no problem.
That's so great.
Yes, so I ran the program over there.
Fantastic.
And it's a country that isn't as restrictive as, say, Saudi Arabia. So there were actually young men in the program as well, and the women and men could take classes together. So it's not quite as restrictive. I was surprised there were men in the program, but there were, and they were great. And it was a fabulous experience, both for my husband and myself.
That's awesome.
Yeah.
So what kind of struck this passion for global health?
Well, I've always liked to travel. My problem was I had 3 children.
Right.
So I had been to Abu Dhabi before to do some workshops over there.
Right.
I had been to South Africa to do some workshops over there. But I could never really go for a long period of time because the kids were in school.
Right.
But then the kids grew up. And so to me, to live and experience another culture is so, it's precious. I call it precious. You learn about yourself.
You do.
You learn about others. You learn there's not just one way to do things. It helps you really grow.
For sure.
Yeah.
For sure. That's awesome.
Yeah.
Fantastic.
One of the other things I remember is stepping off the airplane. I went over by myself to get set up, and my husband came later. And as I was coming out of the airport, there was this beautiful moon, and there was the call to prayer. And I thought, this is a special sign. This means things are going to be fabulous. They were. And every time, well, maybe not every time, because sometimes I didn't hear the call to prayer.
Right.
Every time I heard the call to prayer, I would take a moment and just meditate and use that time to appreciate where I was.
Right. Right.
It was wonderful.
It's a really calming experience when you go there and you do experience that.
Oh,
it's fantastic.
it is. It is.
I love going to the Middle East for that reason.
I do too. I do too.
It's a different environment.
Oh, it is. It is. And another funny time, my husband got ill over there, and we had to go to the hospital, and we were in a waiting room, and he was going to see the doctor. And we were in the waiting room, and all of a sudden the call to prayer came, and everybody left the waiting room, went over, to the carpets on the side, and started to pray, and we were the only ones left. You'd never see that again.
No, you went.
It's beautiful, beautiful.
It's fantastic that you had such an enriching experience.
Oh, it was wonderful.
So tell us one of your best experiences within global health.
Oh, there's so many. I think there's two. One is a more personal one, and the other is a more healthcare one. So when I was over there, I had the privilege of working with the senior nurses in the hospital.
Oh, fantastic.
It was amazing.
Great.
Amazing. And to hear what some of their issues were. So the University of Calgary was invited over there to offer a degree program because nursing in Canada is very well respected over there.
Yeah.
But the issues that the hospitals faced, it was almost as if they were 20 years behind where we are in Canada. Not with their equipment. They have the most fabulous equipment in the world, but it's getting people to use that equipment, to be educated and trained to use it, to educate nurses that they can be leaders.
Right.
So that was an enriching experience. We did a lot of conferences together. We did planning together. We planned some of the courses together. And over there, I was just thinking about it before you came. The nurses still wear caps.
Yeah.
And they wear like epaulets with stripes, like the army.
Yeah.
And here, nurses. Well, that's one of the things over there. You can tell a nurse is a nurse. Here, you don't know who's who because we don't have a uniform. But so that was one of my most enriching things, to meet the nurses on the floor,
right,
to talk with them about what we needed to do. But the other, a personal one, was one of the students invited several of us to go to her family's home.
Oh, that's amazing.
It was amazing. So the men and women were separate. We didn't eat together. But they had a farm. It wouldn't be the kind of farm we know in Canada.
Exactly.
But they had camels, and they had a little garden, and all around the main house, there were other homes for other family members. And you drove into the courtyard and chickens, and it was wonderful. And the student's mother couldn't speak English, but we got talking anyway. We could communicate. We laughed over food, and to me, that was just to be invited into a national's home and see how they lived and be welcomed, and it was wonderful.
That's fantastic.
It was.
What an enriching experience in itself.
It was.
Oh, that's awesome.
The other thing is when you're that far away from Canada, you're close to a lot of other things you'd probably never see.
Right.
So we were able to go to Jordan. We were able to go to Oman. So we went to Abu Dhabi and the city on steroids, Dubai. It was an unbelievable experience. But we got to travel around, you know, to see other places, which was great. Just great.
So unique in itself because
Yeah.
it gives you that exposure to such an abstract experience
Yeah.
in the sense that it's something you'll never be able to
You can't
really
experience
see unless
here.
you see one-to-one or firsthand.
Exactly. So to live in the Middle East,
Yeah.
to see the culture, to get to know people who were born there or who were nationals, it was a real privilege. Just
Right.
such a privilege.
Right. So what are one of the biggest recommendations you would give for an individual interested in global health?
Travel, travel, travel. Don't be afraid. I think back on it, although my husband had a job, he worked in this hospital here. So we never kind of said, okay, as a family, why don't we go? We could have. We could have. We didn't. We waited till later. But just take an opportunity to go and see. I mean, there's so many fabulous places in the world. And when you're involved in healthcare, there's usually something you can do in that country, whether it be United States or England or, one of the more Western countries or Africa, South Africa. It's amazing.
That's awesome. Have you ever felt limited as a nurse being in that kind of environment?
Absolutely never. Absolutely never. So people said to me, oh, when you went to the Middle East, how did they treat you as a woman? They were fabulous. They were fabulous. I never felt there was a problem. Never. I worked with the Minister of Health over there because it's a small country, so you get to know all the higher ups.
Right.
Never. So, and as a nurse, I've always been very, very well respected, no matter where I've gone. People look up to nurses, I think.
Yeah, they do.
Yeah.
It's so great to hear that from someone that has experienced that.
Yeah, absolutely. They really do.
It's rewarding in itself.
Yeah, yeah.
So tell us about one of the most rewarding situations you've ever been in, or one of the most enriching experiences you've ever had.
I think it was, well, there were many when I was over there. And when I went to South Africa, I got to work with some students there. And when I was in Abu Dhabi, I got to work with students. I would say most of the time, because I didn't provide hands-on care, most of the really meaningful experiences came through my students. And I'll tell you a story about South Africa. So I was in South Africa after apartheid. So while I was there was the Truth and Reconciliation Commission or committee meeting. And I had been asked to go over to the School of Nursing in Johannesburg to talk to them about problem-based learning, because they were interested in looking at new ways of educating their nurses. So I said, well, why don't I actually work with your students and model how you facilitate a group, how you help them go through a problem. Like, I could give you talks, and I did, but I'll take one of your student groups and I'll do it. So I can't even remember what the problem was, what the situation was that we were sorting out. But it was so different. I do remember now. So it was someone from rural South Africa that had to walk 10 miles to the local health clinic.
Right.
Anyway, so all of a sudden I've got this culturally different situation in front of me, but the students were fine with it. They were fine. But through the course of the discussion, one of the male students was very, very quiet. So, as I do in problem-based groups here, I said, Simon, you're very quiet. And he said, I have a hard time talking and calling you Carolyn and not wanting to put up my hand. I don't feel comfortable in talking with you the way you want us to talk with you.
Right.
And I thought, geez, Carolyn, and so we began to talk about it. And he said, in our schools here, we treat teachers with respect. We call them doctor or Mrs. or Mr. And I just can't call you Carolyn, and I just can't not put up my hand. And so again, how enriching students are when they're teaching. You think you're there to teach them.
Exactly.
And they're teaching you.
For sure.
And the same with in Doha. I just had some wonderful times in my office when the students would come and want to talk about starting a club or a debating society. My goodness, we would laugh. We'd close the door and we'd laugh. So
what a great relationship.
Yeah, I did. And one of the students invited us to her wedding. Oh, it was amazing. They throw money. And the men and women are separate.
Yeah.
It was fabulous.
Unique experiences.
Yeah, fabulous experiences.
Awesome.
So it's been very enriching.
That's fantastic.
Very enriching.
Have you ever found culture to be a barrier or an obstacle?
No, I haven't found it to be an obstacle, but it does take you back when someone tells you they don't feel comfortable in calling you Carolyn.
Right.
And I see why when he started to explain.
Right.
So you can be taken back a bit, but no, I've never found it an obstacle.
That's fantastic.
Yeah.
Fabulous. And I guess last thing would be any words of wisdom for our future global health leaders?
Well, lots. I guess one, to remember if you're traveling and working in other countries, to remember where you are and the culture and to be respectful of it.
Right.
And the other is the world is not that big. It's amazing how you may meet somebody in Doha and then meet them back here.
Yeah.
Or meet them in England and then meet them at the ICN conference again. That the world is tiny. And so never burn your bridges and always end well when you're leaving a country because you never know when you're going to go back. Because I go back now twice a year.
Oh, nice.
I sit on the board of directors over there for the school.
Right.
Yeah, so I get to go back and see students.
That's awesome.
Yeah.
And best travel advice that you can share with anybody?
Be prepared for long walks and long waits. And don't let yourself get hassled by it. Because have you traveled?
Yeah.
The hiking you have to do, and then you have to line up, and then you have to line up again. But I just take it as it comes and enjoy it.
Thank you for
You're
sharing
very
your time
welcome.
with us.
You're very
appreciated
welcome.
it.